No medicine can remove the cause of a lifestyle disease, but you can.
Today is Cancer Day, but this talk is not meant only for those who carry a diagnosis of cancer. It is for everyone whose life has been touched by cancer, directly or indirectly. It is for the patient who is trying to be brave but feels afraid inside. It is for the caregiver who holds everything together during the day and collapses quietly at night. It is for families who suddenly find their lives divided into before and after. And it is for survivors who are grateful to be alive, yet still live with uncertainty. Cancer does not affect one person alone. It affects an entire circle of people. It changes conversations, priorities, and the way we look at the future. Let me say something important at the very beginning. Cancer is serious. We must never underestimate it. But cancer is not helplessness. Modern medicines have given us powerful treatment, surgery, chemotherapy, radiation, immunotherapy, targeted therapy. At the same time, healing is not only about attacking cancer, healing is also about supporting the body that is fighting it. And this is where today's message begins. Treatment matters, but your biology matters too. Before we talk about cancer, we must talk about the person. Because somewhere along the journey, many patients start feeling reduced to reports, scans, and numbers. Stage this, grade that, marker levels, scan results. But you are not a scan, you are not a report, you are not a stage number, you are a living, responding biological system. Your emotions, memories, resilience, fear, and hope, all working inside a physical body that is constantly adapting. When medicine focuses only on disease and forgets the person, outcomes suffer. When medicine respects the person and the biology together, some things changes. Patients feel seen. Families feel involved. Healing becomes more than a technical process. This talk is about restoring that balance between science and humanity, between treatment and biology, between survival and living. This is about how to use your body's healing power or how to empower your immune system to fight cancer. One of the most painful questions patients ask is, why did this happen to me? Often this question carries guilt, self-blame, and confusion. In clinical practice, we see patterns, long-standing inflammation that caused no pain and was ignored. Metabolic problems like insulin resistance that were called borderline and never corrected. Poor sleep, chronic stress, gut imbalance, immune system exhaustion. Quite problems that accumulate over years. Cancer is usually the final expression of a long biological imbalance. This understanding is not meant to create fear, it is meant to create clarity. Cancer does not grow overnight, but healing begins the moment biology is understood and respected. Cancer is often described as chaos, but when we look deeper, the cancer is not chaos, it is adaptation. It is a survival strategy, but a misguided one. When the internal environment becomes hostile, low oxygen, high inflammation, unstable metabolism, normal cells slow down. Cancer cells adapt. They change how they use fuel. They learn to survive under conditions that would normally stop cell growth. This tells us something profound. The body always chooses survival, even when it chooses wrongly. Instead of only asking, how do we destroy cancer? We must also ask, why is the body allowing this survival pattern to exist? When we support biology, we help the body choose better survival strategies. This shift in thinking changes everything. Cancer cells are not weak, they are extremely intelligent survivors. They consume sugar, glucose aggressively. They grow even in low oxygen environments. They hide from immune cells. They ignore signals that tell normal cells to stop dividing. This behavior thrives in one condition: biological chaos, high inflammation, poor metabolic control, high glucose level, insulin resistance, confused immune signaling. When the internal environment is enabled, cancer finds room to grow. When the environment is corrected, growth patterns change. If cancer grows in a weak biological environment, healing grows in a strong one. Supporting biology is not an abstract idea, it is a clinical strategy. Inflammation is one of the most underestimated forces in cancer biology. It is not dramatic, it does not always cause pain, but it acts like a slow burning fire. Markers like CRP, ESR, ferritin, and others help us understand how intense this internal fire is. Persistent inflammation sends continuous signals for cells to divide, repair, and survive, conditions cancer cell exploit. Reducing inflammation is not alternative medicine. It is a biological necessity. Nutrition, sleep, metabolic control, gut health, and stress regulation all play a role here. Just treating the tumor is not sufficient. We should have strategies to calm the fire, inflammation around it. For providing the best care for cancer patients, focus should be given not only on tumor removal and suppression. We should give equal importance to reducing the causative factor, inflammation, the silent fire burning inside our system. Early diagnosis is one of the most misunderstood idea in cancer care. Many people fear investigation because they believe that finding cancer early somehow creates the disease. That is not true. Cancer does not appear because we look for it. Cancer appears because biology has been struggling silently for a long time. Cancer appears when we do not look for or ignore the warning inflammatory markers and tumor markers. Early diagnosis is not about fear, it is about respect for time, for biology, and for life itself. Tumor markers, inflammatory markers, metabolic markers, and scans are tools that help us understand what is happening inside the body before symptoms force our attention. Inflammatory markers, metabolic markers, and tumor markers will start rising years before cancer appears. Scans tell us where something is happening. Markers tell us how active and how aggressive the process may be. Time in cancer care is not just a calendar concept. Time is biology in motion. When precancerous markers are detected early, treatment is simple. Just lifestyle management and surveillance may be sufficient to reverse the disease biology. Even when the cancer process diagnosed at the stage 1 or 2, treatment options are broader. Interventions can be gentler, and the body has more reserve to respond. But when diagnosis is already delayed to stage 3 or 4, biology is often already exhausted. Early diagnosis preserves options. It preserves strength, and most importantly, it preserves dignity in decision making. In this era of high tech diagnostics, diagnosis in the precancerous stage and early lifestyle correction with clinical support and reversing disease biology should be the gold standard. One of the most common reasons for late cancer detection is waiting for symptoms. Unfortunately, many concerns remain silent for years. By the time pain, weight loss, bleeding, or visible changes appears, biology has often been under stress for a very long time. Symptoms are not early warnings, they are late signals. This is why appropriate screening, routine evaluations, and attention to subtle changes matter. Detecting cancer early often means less aggressive treatment, shorter recovery time, and better quality of life. Detecting cancerous stages make it simpler and safer. Just lifestyle correction or clinically supported lifestyle correction will be sufficient. This is not about living in fear. It is about listening to the body before it is forced to shout. Seeking evaluation early is not anxiety, it is self respect. The moment cancer is suspected or diagnosed is one of the most emotionally overwhelming moments in a person's life. Everything suddenly feels urgent. Fear takes over. Information overload begins. But let me say this clearly, diagnosis is not the end of the road. It is the starting line. It is the moment when biology needs attention immediately. Do not panic. Not paralysis, but structured, calm action. This is the time to reduce inflammation, stabilize nutrition, preserve muscle, regulate sleep, and support emotional balance. These steps do not interfere with the cancer treatment. They strengthen the body that must undergo treatment. Start lifestyle correction with the expert guidance and support. Doing nothing while waiting for treatment is not neutrality. It's a lost biological opportunity. While your oncology doctors are waiting for the biopsy, receptor, or genetic test to decide which surgery, which chemotherapy, and radiation strategy, you start acting to support your body, your immune system. Use the body's healing power. Empower immune system with optimal nutrition, physical and mental activity, and rest. Improvements can happen, or at least your body and mind will be more prepared to face the challenging treatment protocol. Clinically supported lifestyle correction at the time of diagnosis is often misunderstood. It is not about rejecting medical treatment. It is not about extreme diet or unproven alternative medicine or methods. It is about scientific medical preparation, preparing, strengthening your body mentally, physically, and emotionally. Just as patients are optimized before an elective surgery, the body must be optimized before cancer treatment. Inflammation, muscle loss, obesity, metabolic instability like insulin resistance and high glucose levels, high BP, and poor nutrition directly affect how treatment is tolerated. Most of these patients will be on multiple medications taking for lifestyle related type 2 diabetes, hypertension, heart disease, thyroiditis, etc. When lifestyle correction is guided by expert clinicians, it becomes a medical tool, not an alternative therapy or ideology. With the clinically supported lifestyle correction, with the cell activation protocol, the protocol we follow here can help you to overcome insulin resistance and normalize blood glucose level within a few days. Reduce or taper off medication for type 2 diabetes, hypertension, etc. within weeks. This will help the body's and immune system to give us full attention to removing cancer cells and healing the surgical wound or replacing the damaged normal cells with the healthy new cells without DNA damage or mutations. Moreover, lifestyle correction with the scientific technology assisted nutritional and metabolic correction will reduce most feared infection postoperatively and while on immunosuppressive or modified chemotherapy. We often see two patients receiving the same treatment for the same cancer with very different experiences. One tolerates the therapy reasonably well, the other struggles with severe side effects. This difference is rarely luck, it is biology. A body burdened by inflammation, insulin resistance, nutritional deficiency, Excess inflammatory fat and muscle loss experiences treatment as trauma. A supported body experiences treatment as stress, but manageable stress. Biology determines tolerance. Biology determines recovery. Biology determines resilience. This is why supporting biology is not optional, it is decisive. When cancer treatment begins, whether it is chemotherapy, radiation, surgery, or immunotherapy, the focus naturally shifts to schedules, cycles, doses, and scans. These are all important, but there is something equally important that often receives less attention: the condition of the body that is receiving the treatment. We give importance to surgery, chemo, radiation, schedules, but often neglect nutrition, exercise, and rest. Cancer treatment is not gentle. Even when it is life saving, it places enormous stress on the body. Blood counts fluctuate, appetite changes, sleep is disturbed, muscle weakens, and emotions are stress thin. Two patients may receive the same treatment, yet their experiences can be very different. Why does this happen? Because the treatment does not act in isolation, it acts on biology. Clinically supported lifestyle correction, if started while awaiting test reports, prepares the body and mind. If started during treatment, it focuses on sustaining and stabilizing the body and mind, preserving muscle mass, stabilizing blood sugar, supporting gut health, improving sleep quality, and maintaining emotional resilience. This support does not weaken treatment, it strengthens the patient. Lifestyle correction with clinical and technology support will help to prevent future cancer recurrence. Strong patient handle strong treatments better. It is not an optional add-on. It is responsible, compassionate medical care. Few areas in cancer care are surrounded by as much confusion and fear as nutrition. Patients are often told conflicting things: avoid sugar, avoid protein, eat less, eat only certain foods. This confusion creates fear, and fear leads to weakness. Let us be very clear: cancer feeds on metabolic chaos. The nutrition needs to be directed to starving the cancer cells but empowering the immune system. Your own real doctor tirelessly working on removing the cancer affected abnormal cells and replacing damaged normal cells affected by chemotherapy and radiation with the new healthy cells. When patients stop eating properly due to stress, drug, and radiation related side effects, the body weakens, immunity drops, muscle is lost, and treatment tolerance reduces. Cancer cells feed on starch, sugar, and glucose. The common food items, cereals, fruits, vegetables, etc., are rich in carbohydrate, which is converted to glucose after digestion. The PET scan, commonly used for diagnosis and staging of cancer, makes use of radio-labeled glucose to find cancer-affected areas. Cancer patients should make use of this glucose craving nature of cancer cells. The ideal diet of a cancer patient is a low carbohydrate diet, but it should contain all nutrients in the optimal proportion, especially the omega 3 to omega 6 ratio 1 is to 1. Equally important is to minimize toxins entering the body with food as color, preservatives, tastemakers, etc. In my practice, CSLC camp, that is clinically supported lifestyle correction with cell activation protocol, we educate and support the patient to ensure an optimal nutrition, anti-inflammatory diet, which is low in carbohydrate but high in anti-inflammatory omega 3 fat with an omega 3 6 ratio 1 is to 1. This will balance the activities of the inflammatory or the defense activities and anti inflammatory or the healing activities of the immune system. Low carb, low glucose diet starve the cancer cells. But normal cells in the body can live with minimum glucose and shift to ketone bodies and fatty acids for their energy needs. But cancer cells use glucose for energy and growth. And also, when the patient eats sugar and carb, insulin levels spike, and this will stimulate the cancer growth like oil on fire. A low carb diet can starve the cancer cells and reduce its multiplication and support regression of the tumor. Clinically guided nutrition during cancer care is about balance, adequacy, and timing of food and nutrition. It helps preserve muscle, stabilize blood sugar, support immunity, and improve recovery between treatments. Low carb, optimal nutrition is about fighting cancer directly by starving the cancer cells selectively while strengthening the immune system and healthy cells. Prolonged activity sends a dangerous message to the body that survival is no longer necessary. Movement sends the opposite message. Activity during cancer treatment is often misunderstood. When people hear the word exercise, they imagine intense workout or physical strain. It is not what we are talking about. Activity, physical and mental, is medicine when it is gentle, appropriate, and supervised. Even simple movements, walking, stretching, light strength work, send powerful signal to the body. They help preserve muscles, improve circulation, enhance insulin sensitivity, and reduce fatigue. They also improve mood and restore a sense of control. Movement tells the body, we are still here, we are still participating in healing. Life responds to movement. Now we look into what is an ideal exercise for a cancer patient. The human body has around 650 muscles and 250 bones. An optimal exercise means stimulating all these muscles and bones in a systematic way without straining any part of the body. When a body part is stimulated, blood flows to that part is increased. When blood flow supply is increased, more oxygen and nutrients reach the concerned cells and the metabolic waste is taken away for excretion. This will help detoxification of the system. Remember, toxin accumulating in our body over time is a root cause for mutations in our DNA resulting in cancer. Healthy normal cells need oxygen, while mutations and cancerous changes are promoted in a sedentary, low blood flow, low oxygen, low essential nutrient, toxic, metabolic waste accumulated environment, leading to cancer growth and spread. In clinically supported lifestyle correction with cell activation protocol, structured, segmented, gentle exercise in lying or sitting position encourages the patient to stimulate all 650 muscles and 230 bones. This exercise pattern indirectly stimulates all internal organs, immune system, hormone system, nerve system, etc. Cancer rarely exists alone. Many cancer patients live with other lifestyle diseases like diabetes, hypertension, insulin resistance, obesity, thyroiditis, arthritis, fatty liver, etc. These conditions quietly shape the internal environment in which cancer grows. High insulin level act like growth signals. Poor glucose control increases inflammation, feeds cancer cell, and promotes cancer growth. Fat accumulation disrupts hormonal balance. Together, these factors create a biological environment that cancer cells find favorable. Correcting metabolic disorders is not a side issue in cancer care. It should be the strategist regime in prevention, during treatment, and post survival surveillance and recurrence prevention. It should be the foundation and support in all cancer care regimes. When blood sugar control improves, when insulin resistance reduces, when inflammation drops, with the scientifically monitored lifestyle correction, with the technology and clinical support, immune functions improves and cancer clearance recovery and recurrence prevention becomes simpler. When metabolism and immune system improves, resistance improves. Supporting metabolic health strengthens the body's ability to respond to treatment and recovery. One of the most overlooked truths in modern medicine is the human body's ability to heal. The human body is designed to heal, healing not an exception. It is built in biological function. We see this every day. A wound heals, an infection resolves, a fractured bone repairs itself. The body is constantly correcting, adapting, and restoring balance. Cancer challenges this ability, but it does not erase it. Healing does not always mean cure. Sometimes healing means slowing disease. Sometimes it means better tolerance to treatment. Sometimes it means improved strength, clarity, and quality of life. And sometimes healing simply means dignity and comfort. What determines how much healing is possible? The answer is biology. When inflammation is persistently high, when nutrition is inadequate, when metabolism is unstable, and when sleep is disrupted, the body healing capacity is suppressed. When these burdens are reduced, healing pathways often begins to function again. Healing is not magic. Healing is biology, given a fair chance to work. Modern medicine is powerful. Oncology has saved millions of lives, but even the best medical treatment works through the body, not outside it. Sometimes enough focus on attacking the disease, we forget to support the system that must recover after all. The body has innate repair mechanisms, immune surveillance, cellular repair, hormone regulation, metabolic balance. These systems do not disappear because cancer appears. They become overwhelmed. When we reduce biological noise, chronic inflammation, metabolic overload, nutritional deficiency, emotional exertion, the body often responds quietly but meaningfully. The tragedy in cancer care is not that healing fails. The tragedy is that healing is never fully supported. Supporting biology does not compete with the treatment. It allows treatment to work better. Completing cancer treatment is a major milestone, but it is not the end of the journey. In many ways, it is the beginning of a new and vulnerable phase. After treatment, many survivors live with fatigue, muscle loss, metabolic imbalance, immune instability, and fear of recurrence. The scans may be clear, but biology may still be fragile. This is where clinically supported lifestyle correction become essential, not optional. Survivorship is not passive waiting. Survivorship is active support for chemistry, metabolism. Correcting biology is the key. Prevention of recurrence depends on how effectively and scientifically you are able to support the body. Remove the cancer causing mutagenic elements in your life. Rebuilding muscle, restoring metabolic health, reducing inflammation, supporting immunity, and stabilizing emotional well being are all part of preventing future illness. Survival is about years, quality is about life. Cancer recurrence rarely happens suddenly. It often follows silent biological deterioration, slowly raising inflammation, worsening insulin resistance, muscle loss, chronic stress, and immune fatigue. Preventing recurrence is not about living in fear. It is about rebuilding resilience. With optimal nutrition and activity, when biology is strong, the body is better equipped to detect and control abnormal cells. When biology is weak, surveillance fails. Preventive care about cancer focuses on strengthening the internal environment so that disease finds less opportunity to return. The goal is not to promise zero recurrence. The goal is to create the strongest possible biology, not just to live longer, but to live stronger. Every cancer journey has people who do not appear on medical records, but without whom the journey would collapse. These are the caregivers. They remember appointments, manage medicines, calm fears, coordinate families, and often suppress their exhaustion so that the patient can feel safe. Caregivers carry an enormous emotional load. Over time, fatigue becomes normalized, anxiety becomes silent, and burnout slowly sets in. What many people do not realize is this caregiver stress directly affects the patient outcome. When caregivers are overwhelmed, decisions become harder, patients become thinner, and emotional stability at home suffers. Stress is contagious, and so is calm. Caregivers also need education, reassurance, and rest. They need permission to care for themselves without guilt. Supporting the caregiver is not a luxury, it is part of the responsible cancer care. You cannot pour strength from an empty body, and caregivers deserve healing too. In cancer care, hope is essential, but it must be honest. False promises create temporary comfort and long term harm. Unrealistic expectations can lead to disappointment, guilt, and loss of trust. This message is not about miracle cures. It is not about rejecting modern oncology regimes. And it is not about choosing one path of another. It is about integrated hope, hope grounded in science, biology, and compassion. Real hope recognizes the seriousness of cancer while still believing in the body's capacity to respond. It acknowledges uncertainty without surrendering to fear. It uses every legitimate tool available: oncology, scientific and technology assisted lifestyle correction, emotional support, and careful monitoring. Hope becomes strongest when it stands on truth, dignity, and evidence. Let me summarize about a holistic, optimal approach plan to cancer: prevention, treatment, surveillance, and recurrence prevention in the current scenario. What we, the people, patients, caregivers, medical professionals in cancer care, should understand is that the root cause of cancer is an accumulated toxic overload, nutritional deficiencies, and stress in day to day life, resulting in genetic change at cellular level, the DNA damage and mutations. Basically, cancer is a lifestyle disease. Therefore, lifestyle correction should be the pillar in all stages of cancer care, including prevention, treatment, and recurrence prevention. Ignoring or not giving due importance to the root cause of the disease is the major flaw in modern cancer care. Cancer specialist, surgeon, oncologist, radiation therapist manage the disease with extensive radical surgery to remove the cancer affected areas. Use chemotherapy, targeted therapy, hormone therapy, immunotherapy, radiation, etc. But we forget the root cause, the lifestyle factors, and forget to correct it. We do surgeries, we adjust medications doses, but the patient misses out on the knowledge and support needed to find and fix the lifestyle flaws. We need a scientific, technology assisted, evidence based method for lifestyle correction. Our effort to fill that lacuna in modern medical care shaped CSLC CAMP, clinically supported lifestyle correction with a cell activation protocol. What is clinically supervised and supported lifestyle correction? It has three steps. The first step is assessment to assess the body's composition and fat percentage and determine the optimal body composition goal. The second step is diagnostic test to assess the health status of organs, heart, blood vessels, liver, kidney, stage of the cancer growth and spread, immune status, hormone and nutritional levels, and to understand the specific food that suits or do not suit the body. The third step is the lifestyle correction plan. It focuses on providing optimal nutrition and activity pattern tailored to the patient along with reducing the body's toxin load. The aim of CSLC camp is to restore and maintain the balance of metabolic process, inflammatory and anti-inflammatory aspects of immunity and hormones. Chemical activity is vital for life. By creating an optimal environment for body cells to function, it is observed that for most patients suffering from diseases like diabetes, pressure, heart disease, allergy, arthritis, etc., who have been on medication for years, most medication can be reduced and stopped within a month with the support of modern diagnostic tests and follow-up. Lifestyle optimization helps to optimize and balance the internal environment at cellular and molecular level. This will strengthen the body. Postoperative complications will be reduced and recovery faster. The sole focus of the body immune system can be diverted to cancer cell eradication and manage the side effect of chemo and radiation therapy. This will make the cancer care simpler, more effective, and less stressful for the patient and the caregivers. Next, let us look at the scientific basis of lifestyle correction. Clinically supported lifestyle correction focuses on empowering immunity, the body's self healing power, which is fundamental to disease prevention and recovery. We focus on three things to rebuild the body with new healthy cells. First is nutrition, ensuring the body receives all the necessary nutrients, around 57 nutrients, including 14 vitamins, 14 minerals, 20 amino acids, 4 fatty acids, 2 carbohydrates, glucose, and dietary fiber, along with the oxygen and water in optimal quantity and proportion. Second is exercise and circulation. Through gentle, segmental, and optimal activity, try to stimulate all cells, increase blood flow at cellular level, and help flush out accumulated toxins. Third is toxin reduction. Reducing the toxin entering the body through food, water, air, cosmetics, and medicines, and removing the accumulated toxins. A sustainable solution for cancer, a lifestyle disease. Oncology care alone is insufficient. Oncology treatment comes only with the final tissue diagnosis. But lifestyle correction has a role in correcting the underlying flaws in lifestyle, the root cause leading to cancer. It includes the stages of preclinical detection and prevention, treatment of preclinical conditions like diabetes and hyperinsulinemia, reversing precancerous conditions like metabolic hepatitis, preparing the body in the time of cancer suspicion, and awaiting test reports. During the oncology treatment period, the importance is for optimal biological support to best recovery with the better management of side effects as well. For prevention of recurrence after oncology treatment and during the surveillance period, it is best to strengthen the patient's biology. More information on different lifestyle diseases, various modern medical treatment methods, their pros and cons, and clinically supported lifestyle correction is available on the website and in our videos on this channel. Links are given as pinned comments. The real medicine, the sustainable solution for lifestyle disease is lifestyle correction. Remember, cancer also is a lifestyle disease. So, lifestyle correction with the scientific support should be given its due importance for primary prevention to secondary or recurrence prevention. Thank you.
The informed patient is key to treatment success. For more health videos and the lifestyle correction approach, subscribe the channel and enable the bell icon.